Great. Yeah, I'm totally with you there. And I don't know, for me with regards to my audience and letting them in on my journey and everything, it's like, how much do I share and what in real time? Because,
Hmm.
for me, I was like, well, I just assume, I'm 34. And so I'm ready to do this thing for the first time. I was definitely
Yeah.
feeling the pressure of the timeline. I mean, the first time I got whacked in the face with the timeline was I was when I was waiting for my husband to propose to me. And I was like,
Yeah.
all of a sudden I realized if you propose now and we're engaged for 1 year and then we want to be married for 1 full year before we go down this road of parent or not parent, I'm already 34 or 35 by the time, and you haven't
Yeah.
given me the ring yet. And I remember like having my heart kind of like beat out of my chest a little bit where I'm like, oh my gosh, I like it all of a sudden settled. And then that angst that was the
Yeah.
first time that I felt the angst around relationship and timeline and family and all of these things. And then health stuff too, because then I was like, well, if it takes me a year to prepare my body for this
I
thing and prepare
know.
my mind for
Yeah.
this thing, and there's all these people in my, these professionals in my sphere that I'm paying attention to that are like, if you want to have a super baby, then you got to do it this way. And you have the
Yeah.
year of preparing ahead of time and all these things. And I'm like trying to map this out. And there's my husband like, what?
I know. Well, the other thing too that really gets me is how often I talk with people and they're like, yeah, like my doctor's looking at this for me and looking at that for me, and I'm struggling. And I'm like, what do they look at for your partner, like your male partner? And they're like, oh, yeah, yeah, don't worry about that yet. And I'm like, this is such BS because men's health plays a pivotal role, not only your ability to get pregnant, right? And that's like the first like goalpost where like there are so many goalposts. They're like in pregnancy and the whole journey. But with that, it's the very first one, right? Of like just get pregnant. But we fail to recognize that like the sperm is also really important in staying pregnant. Having a healthy embryo divide the way it should. And the majority of miscarriages are going to be because things that were outside of our control, right? Like cells divided wrong. Like they've got to divide perfectly. When you think about how they have to get it right and how often they do actually get it right, it's astounding to think that like there's even that probability. But in terms of babies' outcomes, like their health in the long term, that it all is impacted by sperm quality, i.e., the male partner's health. And I think it's just as you were talking about in the timeline, like men think they don't have a timeline. Yet we know the quality of their little gamete that they pass along does degrade over time as well. But, in the society that we're in, it is always like, let's not do research on women or treat them like the special creatures that they are, and actually tailor things for them. But let's definitely put like these like pressures on them and these guilt trips and the shame and all of that. Let's like put the burden on them that if you can't get pregnant, it's a you problem. If you can't maintain a pregnancy, it's a you problem. If something happens with the baby, who sits there and worries about what they did wrong? It's not usually the dad because society hasn't really drilled that in. I also think we have like a special skill as moms to beat ourselves up in that way, which is part of why the human race has survived as long as it has, because we do that and then we try to do better.
Yeah.
Even though like in the moment it really sucks.
Yeah, for sure. Okay. And so, for me going through the one miscarriage, I'm just like, what are all the things that I can do? And, and my husband is like, goodness, he looks like a Greek god to me. He's got like nine
Ah,
abs.
I love
He's
it.
he's so beautiful and like glowing with health. And he takes like, I don't know, an undefinable amount of supplements in a day, and he gets a ton of sunlight and he's very
Mhm.
active. And so I look at him like, you have to be healthy through and through. And he actually had a sperm analysis scheduled the week that I found out that I was pregnant back at the
Oh
end of
yeah.
2022. And so I was sitting there on the couch with him when he called the clinic and was like, well, I'm calling to cancel my appointment because it was literally the same week, like later that week.
Yeah.
And we'd really only just started trying, for maybe a couple months. And then the lady was like, okay, well, do you want to reschedule? And he goes, oh, well, we don't need it anymore. And she goes, oh my gosh, congratulations. And it was this
Yeah.
whole moment. And there's this interesting, like, this interesting information where I'm like, do I, you know, I hear this, miscarriage is very common and we don't really talk about how common it is. And there's something like 1 in 3, but a lot of people don't even catch when they might have even had a miscarriage, but it comes
Yeah.
so early that it just appears as like they've had their period and they wouldn't have even known, and it's these early HCG predictor or HCG tests that allow for people to even know so early on. And so, I hear the comment, and then I also hear with regards to on the male side, well, it's something, and I'm sure that you've heard this too. It goes something like, well, your 2 parts work because they met and you did get pregnant. So it must be good. And that time just didn't work out for whatever its reason, chromosomal, whatever it was that it led to, a pregnancy that was not viable. And so, there's a part of me that wants to like relax and think like, it happens, the thing that happens. And then there's the balance of like, how proactive can I be without being neurotic? And should I encourage him to, and I actually earlier today just sent him a text and was like, sperm analysis ? And he very playfully was like, only if you come into the room with me. And I'm like, I don't think that works that way.
You're
and
like, come into the room with me.
Right. And then he sent me an emoji of a cow and I was like milk. And I'm like, you're so he's also, he's also a character.
Like, what is he trying to insinuate? That
Milk
you're a
it.
cow? Like what?
No, he wants to milk it. Anyway, yeah. So
sir, eggplant and water emoji, those go together. Okay.
Yeah. So he's just like such a character. He's definitely like the clown in our friend group for sure. And I love him for that. And it's mostly, sometimes it's his humor is a defense mechanism that he's learned over time, to get him by. And sometimes it's like the most incredible diffuser, when times get really challenging or I might be panicking and kind of leading me back around to the neurosis, where it's like, how much, like what's the healthy balance of what can I do? What should I choose to do? And in the term should, kind of, how can I maybe remove the shame component to that with the should? And what do I choose to do and what's really available? And how do I choose to do all of this from a really empowering place where I'm looking at this holistically, not just, I want to make a baby, but I want to be healthy and I want to know myself. And I want to know what the risks are and the odds are, but not ruminate there, and before I hit record, we were talking about like the various windows of waiting, when I got that positive pregnancy test, I was like, oh my gosh, I had this like maybe 30 to 60 seconds of, we fucking did it. We did it. It happened. Holy shit. And then literally I had a wave crash over me of, is it going to stick? And then I was like, whoa, where did that come from? And then kind of very shortly after that, I was like, oh my gosh, I don't think that this ends. This could not end, this like perpetual like amount of control, because then it's the next window of what could potentially be wrong. And then the baby comes out and then it's like, is the baby breathing? And am I a good parent? And it's just like a total lesson and I can't control anything. So I would love your perspective because you've been there, done that, got the t-shirt a few times.
Yeah. Got the t-shirt. Fuck that t-shirt. That's how I feel. So as we were talking about last year, I had multiple miscarriages. So last year, I was pregnant. We were so excited. We get to the ultrasound. There is no heartbeat. This is like, when things are getting like sketchy in the US and there's no heartbeat, but the doctors don't want to call it yet. I was leaving for Europe to speak. And I just finally called my MFM, the maternal fetal medicine specialist. And I was like, I've been back several times and they're not going to call it, but there is no heartbeat. And I'm like, I just need you to confirm it. And I need a piece of paper that like says this. And like, so that if I end up, cause I'm going to Europe and if something happens, I just have like a history here and I can just take it in and be like, look, here's the scans, here's everything. Here is this specialist opinion about this. And I went to the UK. I spoke at the Health Optimization Summit. And this is like, man, the universe is so freaking cruel sometimes because I'm teaching on fertility. My talk is all about fertility and biohacking the menstrual cycle. And I start bleeding in the middle of my talk. I feel blood. And like, there was a moment where I was like, oh, like I paused and I like knew, but I was like, okay, just keep going, like stay in your flow. My husband didn't catch it. And I'm like, I felt like everybody in that moment, I feel like everybody knew something was wrong. Like the way that I just lost myself in that moment. And then I kept going. It was very interesting because I had to be there the next day on a panel, and it was just spotting. Like it was just really light, dark brown blood. And I knew what was coming. After that, like the conference ends. And then I feel like my body was like, okay, we can now do this. And like I just laid on the couch and cried in like horrible pain for like that was my UK trip. And I just want to like the health optimization summit. I told them what was going on before I got there, and they were like, any accommodation you need, whatever you need, like we will take care of you. If you need to cancel, like you just tell us. Like they were so wonderful. And I'll just say, as a female speaker, that's like rare to come across at conferences. There have been other conferences that have like accommodated me for breastfeeding and stuff, and that's like also amazing. But then there's conferences that are like, okay, what do you want us to do about it? Just do your job. And you're like, great, fun, okay. So, and you know, just speaking to like the shame and like the perfection, everything, like I had that miscarriage, and then we went to Spain. Okay, alcohol is horrible for our hormones and our body, and like we all know that. But I was just like, you know what, I'm gonna drink some sangria. Like I'm in Spain, I'm gonna drink some sangria. We ended up going to France after that. We tried to world school our kids for part of the year and teach them history and culture and things by being in actually immersed in other countries. And for everybody listening, I do work the entire time. People are always like, oh my God, you get to vacation like several months out of the year. I'm like, when I can do that, I will let you know how I figured it. But no. I have to work still. But with that, I also drank the wine in Paris because like they have really good wine, and you like go to London, and I didn't stress it as much. And yes, people will tell you, yes, like drinking alcohol is not going to be good for your fertility. It wasn't like binge drinking like a bottle to myself every day, right? But I think that's the kind of thing of like, you can't, like people won't even like acknowledge that like there's permission to do that. Certainly if you're like in the middle of IVF and those kinds of things, absolutely not. Like don't be doing that if you're actively trying to conceive. But yeah, last year I went through several miscarriages, one of which like Halloween is like my favorite holiday. And then the day after I had a miscarriage, I doubt my in-laws will listen to this, but my father-in-law had said something cruel to my husband. I felt like it was like a boomer coping mechanism that he had said, you know, it's probably for the best that you like she lost the baby anyways, and like because you guys don't really need more kids. Like what are you going to be like, you know, one of those people that just like has all these kids? And I'm like, yeah, sure, if that's what I want to do, I'll do whatever I want to do. Like this is my life. I take care of these kids. Like what, you come and enjoy them, like you enjoy them immensely. So I don't understand, like, so I think it was more of like him trying to be like supportive and like, oh, like, you know, it's probably for the best kind of thing. And we were going to tell them I was pregnant while they were there. And they were staying with us for a couple weeks, and then I ended up having a miscarriage, and I actually just stayed in my bedroom. I think they thought I was mad at them. I wasn't. I just didn't want to share the experience, and that was harder than being on a stage. To be in my own house, I like am trying not to get teary, but to be in my own house and to feel like I had to hide my miscarriage and isolate and like just not, because I didn't feel like I would have that kind of support. I don't know if that would be like, I don't think that like there's just something about that older generation that unless like they've done their work, they don't know how to support that. Because again, as we talked about before, nobody talks about this. Like these are not normalized conversations. I do want to speak though to the sperm analysis. I always wonder why biohackers are not doing this, because that is one of the most amazing metrics to really understand how viable and healthy you are. So I just like did an abrupt change, like here's a sad story, and like, oh, by the way, but it just is something that I really like, as you were saying, that struck me, that I'm like, why are biohackers not doing this? As like women, we're tracking all of our hormones and we're trying to see like, and these hormones are indicative of our fertility. And so why would men not do the same thing? Because like those glutathione infusions that you're getting, like you will see, like, are they actually working? Because your swimmers, they should be really good at doing their job, and they should look normal, and they should move and they should move in the direction they're meant to move.
Yeah, I'm gonna have to tell Jordan that. later today. I'm just going to say, Dr. Jolene, she said, she doesn't understand why more biohackers, I'm going to just like use the buzzword, why aren't more biohackers checking out their sperm? I mean, yeah, I mean, your fertility, the way that I look at it is, the health and the health of the menstrual cycle, the health, I would say, for men and their semen and their sperm quality and all of that. I mean, it's indicative of so much, and so, yeah. And for me, when I think about my cycle, I've gotten really up close and personal with it over the years. And while in the work that I do, which is primarily helping people with their intimacy,
Mhm.
before we started the trying to conceive path, it's, people would come to me and it's like, how do we rekindle the passion and all of that post having kids, or now we're empty
Yeah.
nesters. And then it started to kind of mimic and parallel where we were really at. And so now I'm having lots of conversations about how do I not have scheduled robotic trying to conceive sex? Like, how do we enjoy this again? How do we make
I talked
a
about this on
baby
my
with
YouTube.
love?
Yes, when I was sharing my fertility journey, I had to take like a beat on YouTube because it was just getting hard. Like I was like, how many times can I come on and talk about a miscarriage is what it felt like. And
Yeah.
this is my own, like, this is like the thing about being in the public eyes. Like you get in your own head and you're like, are people going to get sick of this? Like I'm sick of it. Like I'm certainly sick of it. But
Yeah.
I talked about that piece of like, one of the fastest ways to get out of the mood is the sexpectation that you have to be in the mood and go time. And like and you have to time sex, right? So for everybody listening who's ever thinking about having a baby, you got 1 day for that egg and sperm to meet. The sperm can live up to 5 days, but I'm like, never count on that. Like give it 3, okay, when you're trying to get pregnant. So 3 days before you expect ovulation, and then the day of ovulation. Those are like key windows to hit. But that is just something. There have definitely been times where, because I'm like, I have to have sex, I'm like, I don't want to. And then I'm like, but you have to, because you know how this works. Like, the physiology and like
Yeah.
the mental struggle. Like I'm the person that's like, when it's our anniversary or Valentine's Day, I'm like, I don't I don't think it's going to be hard for me because I feel like this pressure around it. And it's a really common break, like a big stop sign for a lot of people. But nobody talks about that, especially following like pregnancy loss. I think is just another layer in it of like, because I can sit here and tell you that your body is not broken, that like the issue is almost always chromosomal. That's outside your control. Like I can talk you through all of that, and I know all of that. And even while I'm saying that to you, there will be moments where like my little mind whispers to me, your body betrayed you. Your body's broken. Something's wrong with you. And I'm like it doesn't matter how much I know this not to be true. And yet, like, it's just something that like it creeps in. And then you want to be intimate with somebody with your body that you're like having a battle with, that you're like, I don't know how to feel about you right now.
And like wanting to settle down and wanting to like find peace, because then there's the additional component where it's like, oh, you have to de-stress, cortisol, and
Yeah.
relax and like be okay with it. And it's like this really fucked up dance where it's like kind of, bouncing around and running into things. And yeah. And it's really interesting, like having, or I have a really, really close group of friends, and there's one that's just like, we're ready to get pregnant. And then the next time they try, pregnant. And I'm like,
Yeah.
and then healthy baby. And I'm just like, amazing. Look, like she was one of the first ones in our friend group to even get pregnant and then have it. I'm like, oh yeah, see, we're all healthy and we have great, strong community, and we mean it. And I
Yeah.
have
I
all
checked
these,
all the boxes.
yeah. And so, and then I have friends that kind of went back and forth with trying and then pulling back because of thyroid issues. And so I got
Hmm.
to see like how that looked, with navigating Hashimoto's and healing from that. And then what did pregnancy look like for her? And then, just also, on the mindset kind of perspective, then having another friend that we're kind of on the same timeline, only we started a little bit before them, and
Hmm.
now moving through the feeling of what if they get pregnant before we do,
Oh
and how's
yeah.
that going to feel, and feeling these weird and super intense and kind of fucked up waves of jealousy, of grief, of excitement, of celebration. It's just the whole rainbow of emotions.
Hmm. Yeah.
And at the same time thinking, when the miscarriage actually happened, my hope is that I don't have to go through that again, though every year that goes by, the percentage of likelihood of that happening again in some way is increasing for us, because we will be 35 and older as we move through this process if we want more kids. And so just knowing that piece of data, it's, yeah, like
That
there's a part.
data, like it's only really getting significant into your 40s. So I think that's important to understand,
Right.
because
Yeah.
everybody talks about like the over 35, your fertility's tank. It does not just fall off a cliff, and
Right.
your miscarriage rate doesn't just like shoot through the roof. Like it's not until we get into our 40s that's when we start to see significant rises, that yes, things are changing. And if you think about this is like, this is data based off the average person, and the average person, they are not living the kind of lifestyle you are. So keep that in mind. And like, please, nobody like judge us for the sins of our like early 20s and the teenage life. But if you think about that, how the average person lives, like that's significantly different. That's high exposure to environmental toxins. That's going to be eating food that's not protective of the mitochondria. For people who are listening, mitochondria, everyone's like powerhouse of the cells, like makes ATP, energy, great. Yes, but does so much more than that, concentrated in your brain, your heart, and your ovaries. Your ovaries are one of the most concentrated places of mitochondria. This is where I'm like, biohackers do have an edge on that, because they do understand the relationship of health and longevity and the mitochondria, and that is about your fertility. So if you are somebody who used antibiotics for a very long time, like you're going to have to do work just to heal the mitochondria. Like it's been impacted in that way. So you just have to step back and like frame it of like, there's the average people that they're looking at, and the average person isn't healthy. The studies that are like, oh, fertility over like 35 and stuff, like there's like a study like 100 years ago. Life was very different 100 years ago. And so I feel like there's a lot of like fear and rushing into like motherhood, and then having that fear. I had my second child at 40, and I actually birthed him in Mexico, because this was during the pandemic, and I did not like anything. Okay, like firstly, maternal mortality rate very high in the United States, obstetric violence very high in the United States, and then we had hospitals being like, yeah, you can come in, but your partner can't come in, and like no videoing and this and that. I'm like, well, just tell me that you're going to violate my rights. Like, just tell me, because that's what you're essentially, you're setting me up to do, is to violate my rights. And I had just too many people in my life go in and have horrible, horrible experiences. And I was like, no, we're not doing that. So I actually went to Mexico and had a home birth with a gynecologist, an OB-GYN attended my birth, along with a general surgeon and a neonatologist. So like, this is a
Wow.
like, yeah, people are like, oh, Mexico, gross. I'm like, okay, well, like my family's from Mexico. So like, what are you saying? Like, okay, so firstly that, and secondly, like where can you get that kind of setup for a home birth? And it was amazing. And everything was absolutely wonderful about it. But when I asked them, hey, like I'm going to be 40, do you have any concerns about that? They laughed, and they never forget the doctor being like, and he wasn't totally fluent in English, and I am not fluent in Spanish. And like, so like there was some of which we could say to each other, and like we had other people helping us communicate, but he just laughed when they translated. And he was like, tell her, that's how we know you're from the United States, because you think having a baby at 40 is like some big new thing. And I was like, oh my gosh, that is like such
Yeah.
perspective. He's like, women have babies in their 40s all the time here. And I was like, yeah, wait a minute. This is true globally, but in the United States, we actually like, this is like such an outlier situation. And it's even, as we were talking about, the amount of hate that I've gotten from people, they've said some really hateful things that like, yeah, well, you're in your 40s. So like, I mean, literally I remember a DM of someone saying like, yeah, it's a good thing that your baby died because you're too old. And I was like, what did you do? And like, there are moments of grief, and then there are moments of rage where you're just like, you don't even know me, and you just thought you could come in here, you little keyboard warrior, saying hateful things. And I think where I go in that moment is like, if this person had the audacity to say this to me, like who else are they out there just saying hateful, hurtful things to people? And that really upsets me. Because I just think that the internet has such potential to be such a great uplifting place, but God, do people just show like the worst of themselves sometimes?
Ugh, and I'm sorry. I'm so sorry that you experienced that. And it's unfortunately a thing for people who are living their lives out loud for others. And
Yeah.
you know, as far as we go and our following, what we've created up to this point is a small fraction of, you know, what you have and what you've built over the years. And in a day, I will receive so much positive feedback and so much like, you've changed our relationship. You introduced me to this, you know, you introduced me to Jolene Brighten, and now this is so much better. And, or, you know, I love that we get to be a bridge for so many people and that we get to introduce them to so much. And I am filled, my heart is filled with so much joy with all the positive feedback. And then it takes that one motherfucker in the
Isn't it
day.
though? Like, I love that
And
you
then
say that.
I have to like process. I have to like, well, let me go into my tool belt because I literally want to rage right now. And I'm
Yeah,
like, why? I'm like, I just got several messages that were so heartfelt and
I
tear
know.
filled and so thankful. And I've got the one person that's, I don't even know if they're following me. Like,
I know.
are
They're
they,
usually not. And
are
then
they even a
you're like,
person?
yes, are they a bot? Because sometimes I'm like, I don't know. The thing I've also come is like, if this coward cannot use their face and their actual name, then they
Right.
don't get any of my time. Like,
Oh,
and I just chalk it up to like, I'm like, I'm gonna call you a bot because that gives me peace, but like, you're
right.
really just a coward.
Right.
Um, yeah, it's such a complicated thing, you know, as you were saying, like the joy and everything. So I don't even know when this is coming out, but it's like this might be a great like woo moment, or it might be a womp womp. Why I have to say that moment, but I found that I was pregnant on my birthday this year. So we were talking
Mm.
about that before we recorded. And I've been really open about my journey and I want to share this, but I'm in that part of like, I had an ultrasound, there was a flicker, not a heartbeat yet, but there was a flicker, which is a really positive sign. And like my doctors wanted to see me early because after 40, we do want to make sure it's not ectopic. That is important. So,
Yeah.
and then they're like, oh, you have to come back. So I'm literally like, I'm counting every day. I have a week to go to get that next ultrasound. And it's like, as we were saying, like holding our breath. And I wanted to talk about it. And then like Elise Myers on TikTok announced her pregnancy, and then like Megan Trainor, like, and then like another, and like all of these people have announced, and it's like, and I have this, I'm like, oh my God, we're all pregnant at the same time. And even as I've gone through miscarriages, like it's so excited for people. And then there are those moments where like it's like so interesting because you'll hear all these like mindfulness gurus, meditation gurus and stuff be like, you can't be simultaneously grateful and resentful. And I'm like, bullshit. Like you've never had a miscarriage. You've never like experienced like the spectrum of like of human life in that way, because I can at the same time be like, I am so happy for them. And then be like, oh, but I'm so feeling my pain and wishing I didn't see this, but I'm happy that I saw this and I'm
Yeah.
happy for them. And it's such an interesting dichotomy, and it is happening all at the same time. I think sometimes we like to think that emotions go like you're in one emotion
Mhm.
and then you switch to the other emotion, but you can really feel all of that in the same moments. And so as I was saying, I was like, I want to share it, but then like
Yeah.
I like, what if there's a loss? And then I'm like talking about like, oh, like, you know, the loss, and then like how does that impact? Because it's just like, you know, and I'm not as big as like Elise Myers, and I love her, but I still just know how the algorithm works and how like that might get in front of her, or people might misconstrue and think that like I'm being like hateful or all of and I do want to like talk about all of the layers of that. And I like recorded
Yeah.
some videos about how like my doctors were like, go get your HCG, go get, you know, go get your testing, which I've done every time. And this time I was like, no, I'm not going to. I'm going to LA. I'm going to record my podcast, like for my book that's coming out. And I don't want to be worrying about whether or not that HCG doubled. Like I just need to be
Yeah.
in the moment, present. I've got to travel with 2 kids and a dog. I got to be like full brain power, mama focused. I cannot be dwelling in like what ifs. I just need to be like, okay, one foot in front of the other, one day at a time. And now I've come back and they're like, are you going to go get your HCG? And I'm like, no, I am not. We will do the
Yeah.
ultrasound, but like, why jump through the hoop again? It's going to be what it's going to be. We know
Yeah.
it's not a topic. I'm not going to sweat that right now.
Yeah. Different waves and levels of empowerment, and what feels empowering to you at various times. And sometimes I've realized like the data feels empowering until it doesn't.
Yeah.
And the community and feeling like I'm not alone and getting that kind of information feels empowering until it feels like a pity party. And I actually got to get out of here and I got to go find my happy and I got to go let this shit go. And it's so funny, um, two opposite ends of the spectrum emotion thing. And I remember when I was listening to Brene Brown's, I think it's her most recent book, Atlas of the Heart, when she was talking about emotionally advanced or emotionally intelligent people who are ones that can hold two opposing emotions simultaneously, like the term bittersweet, where we're grieving because it's joy that you're losing a thing. And that's so spot on. Yeah. And to think like, in the loss, there's also hope. Like things are working here. Something's happening here. And there's still so much time and so much room and so much hope. And thank you for the over 35 and the joke. And, I did some extensive traveling in my 20s and I always laughed at other countries' responses to our medical system. So I lived and worked on cruise ships for almost 6 years in my 20s. And there was always, yeah. I'm in a lot of places. And I've had medical stuff done in Mexico intentionally because it was cheaper and I was going to get better care in Mexico. And so even when you said that, I was like, oh, I hadn't even thought about that.
There's a lot of people who go to IVF in Mexico as
yeah.
well, because not only is it affordable, but so I'm like biased, right? Being Mexican.
Sure.
I'm biased because I just think that culturally we're very loving and we're very kind. And that has just always been my experience. And that was my experience in the healthcare there as well. And it isn't like this just treating you like a number, a statistic, data, like one more body in a room.
Yeah, they have great bedside manner. It's just like every person that I feel like I'm communicating with or I'm interacting with, you can feel the love and usually the like kind of the stemming their family kind of like stemming out and how they feel about their family. But yeah, I remember when I worked on cruise ships, a lot of times the doctors were from different countries, usually South Africa and a variety of places, UK and all that. And their response was that Americans would go into the medical facility and they'd basically just give them a prescription, because if they didn't, that was like, they would just hand out Z-Packs as if it were candy. Because it was like, people would come and they would have a feeling about a certain thing. And if I just told them, go rest or go get some sun or go, do something good for yourself. And then they might write a terrible review and then their job was in jeopardy. And they totally had no understanding. And I heard this from multiple practitioners, that when they were in their country of origin, it was a totally different experience than when, they were working with the Americans. And so I'm just reminded, it's been a while since I've been in that environment and kind of took it all with a grain of salt. And so I'm happy to just hear that was your experience. And I'm very curious about another part of your story, which is PCOS. So, and I don't think I've spoken to anyone about that on the show yet. But I know that that's also a part of your journey and a part of your story. And so we've got healthy, thriving,
I don't have PCOS. Hang on. Maybe
but
Hashimoto's. I have Hashimoto's.
Is Hashimoto's. Okay. So it was one or the other. And I was going to get it right.
I talk about PCOS all the time and it's in my book. Is this normal? So it's like, that's easy. Yeah.
Great. So, and I have a note here too, and it just says PCOS and I'm like, oh, this must be the thing. So Hashimoto's then. So having autoimmune, having something going on that's like not optimal for fertility. And then to touch on PCOS, I mean, we haven't talked about Hashimoto's and fertility on the show either. So, what the general question though is, when something's maybe not optimal with the body, and then you have several things that might, on paper be going against, what you ultimately want, which would be, having a baby at whatever age, like what does that process look like? Like, how do you work on functionality and like wanting to essentially, I think what I'm getting to, and the question is there a certain place that you feel maybe this is you personally, comfortable with getting at with markers and certain aspects of your health where you're like, now I'm happy to go and open the portal of sorts, like now
Mhm.
is time to say yes, go for baby. And is there kind of like a line too where it's like you can never really get to perfect? And
Yeah,
so
I think that's important to understand that you can't get to perfect because perfect would be cure, and we can't cure a chronic illness. Even though some drug companies do make promises, you really can't. They actually don't want to, right? Because as somebody with Hashimoto's that had enough autoimmune destruction of their thyroid, I have to take medication every day. Like, cha-ching, like you get to be like a forever customer.
right.
And I totally get people's hesitancy to want to be on a medication, but thyroid is non-negotiable. It's like we all understand diabetes. If you don't have insulin, you have to have insulin. It's non-negotiable. You will die. You'll die sooner of diabetes not having insulin available. You will not die as quickly, but you will die painfully if you have hypothyroidism and you don't replace it. And that is because you will go into, you'll start having neurological issues. You'll start having cardiovascular issues. Like you'll start having high cholesterol. Like your body will start to degrade. It no longer can heal. It can no longer recover. It is not a route to go. And so I always explain that to people because people are like, why would you take a medication? And I'm like, because dying sucks. Okay. Like it sucks when you have to do it painfully. But also I like to like show up for my kids and like people in my life. Like that's really important to me. So with Hashimoto's, in any autoimmune condition, we can put it in remission, and the goal should be to get those antibodies in remission. So TPO antibodies, those are the most common to be elevated with Hashimoto's. Those are thyroid peroxidase antibodies. You can also have thyroid globulin. Sorry, let me get that word out. So it can be both. It can be either or. If those are elevated, the research on TPO antibodies has shown us you have a higher risk of miscarriage. And so we definitely want to get those in remission before pregnancy. We want to get them in remission for everyone, just so that you feel good, because remission means that the autoimmune fire has been dampened down and that you're no longer hot and bothered to destroy that thyroid tissue. So the TPO antibodies are really important to track, but I know some providers that sometimes are like, oh, let's check them like every 3 to 6 months. And I'm like, like really like once a year might be better for people, because again, the stress of that stress is going to cause antibodies to flare.
Right.
Stress causes our immune system to get aggravated, and that's important to recognize. So the other thing why we want to get TPO antibodies in remission before pregnancy is they can cross the placenta. And so I have a maternal fetal medicine specialist, because over 40, you're going to need one, because there are some risks that could, like, there's all of these risks with pregnancy. My pregnancy at 40 was easier than my pregnancy at 31. And I felt amazing. Like the entire time, like birth was easier. Recovery was easier. I'm just like, why was I told all this was going to be harder? It was like way better. But the other thing is that if you have Hashimoto's, you should have an MFM, and they should be monitoring your thyroid antibodies. If they're elevated, if you can find them in the 3rd trimester, there needs to be an ultrasound of baby. So if you, right, but like seeing baby's thyroid, because those antibodies could result in hypothyroidism, and that's not compatible with life or thriving. And your baby may need thyroid hormone when they come out. Like there may need to be interventions. And that doesn't mean that like, you did something bad, or that like baby's destined for like this horrible life or anything like that. It's just like, we may have to just temporarily come in, make sure that you're meeting with a neonatologist, that you're getting support from the right people so that baby can thrive and feel their best. So that's just the antibody component. And then there's the whole thyroid component. And so this is something I'm really passionate about, because I developed Hashimoto's postpartum. Called postpartum thyroiditis. Roughly 1 in 12 women worldwide develop it. So common. And it can go into remission after a year, but that's not true for everyone. And after a year, then you're diagnosed with Hashimoto's. And this is just, I honestly think, a silly way the system works, because we're saying like, oh, it'll go into remission, but then it's 50% more likely to come back with your next pregnancy. And that it's going to be permanent. So what are we saying? We're saying like, oh, you have autoimmune potential. We need to address that differently, instead of just being like, you're fine. it's in remission now. So with that, my very first miscarriage was because a doctor mismanaged my thyroid. Your TSH being above 2.5 could make it more difficult to become pregnant, or more likely that you'll have a miscarriage. And so typically we like to see a TSH below 2.5 in that first trimester, and even into the second trimester until baby's thyroid takes over. Now, while I will tell you, okay, so let me back up. Everybody listening, TSH, that's a brain hormone. It's pituitary hormone. Says to the thyroid, make thyroid hormone. Thyroid kicks out mostly T4. T4 is super important. It crosses the placenta. Anybody who has been in the biohacking space, functional medicine, naturopathic medicine, is like educated in any way about thyroid knows that we need T4 and T3. So then they get confused when they're pregnant and their doctor's like, I want to give you Synthroid, which is levothyroxine, a synthetic T4. And then someone like me is like, yeah, good idea. And they're like, but wait a minute. Like, I want to have T3 as well. We want the hormone that crosses the placenta. That is what's going to be super, super important. And T3 can be really aggravating. Like, you have to get it right. And pregnancy is not a time to play around with T3. So T3 but you can make it because that T4 gets converted to T3 in your peripheral tissues. By the way, prenatals have like everything you need to make that conversion into T3s and like to support your body in using it. So that's awesome. You're already doing that. But supporting your gut health, your liver health, your kidneys, like all of that's going to help with the conversion of T4 to T3. So I just covered like a whole lot there.
Yeah.
And I hope that helps answer your question.
No, for sure. I mean, well, that certainly helped with, and I mentioned that when I was talking about our friends, and they're going through their pregnancy journey and all of that. And so, I mean, you breaking it down like that definitely helped because I've heard her in so many ways, like describing these things. And now I feel maybe even a little bit closer to her and her journey. And I'm sure that there's so many people that are listening, that are curious about these things for themselves, or like they went through it, but haven't heard it really talked about that much. And you said, if this is an experience for 1 in 12 people, that's pretty common. So, yeah, it's important. And the question of, like if you have these things going on, it seems as though like for someone who is wanting to be optimal in general with their hormones and their health and fertility and all that, whether they're looking to have a baby or not, just how to look at the body in a holistic way that doesn't feel overwhelming and feels like they can really take action. Because, when I'm hearing that, it's like, okay, well, if you have these things, when it comes down to the thyroid, even then you have an increased chance of miscarriage. And so it's like, okay, well, that wasn't due to chromosomes necessarily, right? So that was something that I could have done. I need to do something
that your
in order.
doctor could have done. Okay.
Right.
Like, let's
Yeah.
make that clear, because
Great.
like, this is not cool to put the burden on the patient that they should be educated in all these ways and know all these things. And yet that happens in the US so often. It should have been your doctor who was ordering that as for part of that first trimester panel and looking at that and being educated enough. But I will tell you that your like average birth provider isn't going to have a clue of what to really do with thyroid, and anything that they did get is really outdated information. And they tend to err on the side of error than on caution. I'll say, like, even working with my own team, my OB-GYNs like just did not understand. They were like, so what happens to me in pregnancy is my TSH always drops, like, and it would look like I'm hyperthyroid, but my T4 will be normal. And sometimes my T3 is even low, like below 3. And I want my T4 to be at least these are free hormones, to be at least 1. And in my third trimester, this is what it looks like. And I was like, yeah, that tracks. That happens with me. And my regular OB-GYN was, this is the one here where I live, not who was going to deliver my baby. She was like, oh, we need to drop your thyroid medication. And I was like, no, you actually don't. If you look at the free hormones. And she's like, you're hyperthyroid. That's really common in pregnancy. I was like, you can't know that. You didn't run Graves antibodies. Like, I'm having this conversation. She's like, I'm going to drop your thyroid by 1/4. When I get the prescription, she was prescribing me 1/4 of what the dose. She didn't drop it by 1/4. And I was like, you can't do this. If you drop my thyroid like prescription, and she wasn't even my main prescriber, but I was like, if you drop it that much, now you put me in risk for preterm labor, preeclampsia, like possibly stillbirth, like this becomes very problematic because my body can no longer, my body has to start choosing like how to survive. And I'm explaining this to her, and I'm explaining like I'm already at this high risk. And she's just like, you just can't have a TSH like that. And I was just like, ma'am, doctor, F the TSH. Look at the full picture of what's going on here. Also, look at how much weight I am gaining. Like, I am gaining like that last pregnancy. Like, I mean, I gained a normal amount of weight, but because it was like post me having COVID, and I had like exercise intolerance, like, well, I had POTS and exercise intolerance. And then after the first trimester, I didn't, and everything started to get better. But like, I had all this time of like inactivity and like difficulty, like even just like, I would try to like do a deadlift. And like after two, I'm like, oh my God, my heart is going to pound out of my chest, like
Oh,
pre-pregnancy. So,
yeah.
there was a lot like to that of like why I was gaining weight. It still just was like a normal weight, but still like I felt like on the high end for my body. And I'm like, if I was hyperthyroid, like think about all the symptoms I'd be having. Like my heart rate would be up, I'd be sweating, like I'm listing this off. And it was just like an argument. And I was just like, whatever, I'm not like, you just can hand me that prescription. Like, I'm gonna do what I'm gonna do. And I talked to my MFM about it. And I'm like, because like even though I'm a doctor and like this is my expertise, like I
Yeah.
still want a like objective opinion about my body. And she was like, do not drop your thyroid hormone. Like your thyroid, she's like, honestly, like your free T4 and free T3 could be higher. Like who cares about the TSH? I was like, word, who cares about the TSH? Because look at the full picture, look at the symptoms, like all of that. And she was like,
Yeah.
yeah, that would be risky to be changing that drastically in your, and like, I was like, I think at that point it was like 30 weeks, maybe 32 weeks. And she's like, yeah, no, we're not doing that.
Yeah. Yeah. And what I hear in that is like, you have to be your own advocate. And at the same time, there's going to be times when, you know, if you're not a doctor and you're seeking out care, that there's potentially going to be some things that you learn. I don't want to say it's like learn the hard way. You're just going to learn. And then, then gain more information, and then you can advocate for yourself, and you can have a bigger picture of your test results and what they mean for you and your unique body and where you're at and all of that. And so, it's pretty incredible. So I want to shift a little bit and just ask just generally about the topic of hormones and the role that hormones play. Now when after the miscarriage that I recently had, I at first I was like, okay, well, I'm just gonna de-stress my life, and at first I was like, I'm not gonna go back down the functional medicine route. I'd done it a couple years prior when I was in the prep phase for baby. That's at
Yeah.
least what I thought. And I had all these markers for SIBO, and had my gallbladder removed when I was in high school.
Oh
And
man. Yeah.
so I had like, there was like stuff, going on, and had a South Louisiana diet pretty much my whole life, and only found my way to health and nutrition and fitness and well-being and all that. And, towards like the start of my 30s, basically the end of my 20s, start of my 30s. And so, and like I knew stuff was going on in the gut. And I remember, when I first got the early release of your book, and I like immediately flipped to the page that was like periods and pooping or something, or it was
Yeah,
like,
period diarrhea.
yeah, I don't know if it was exactly that, but my issue was constipation for the majority of my life.
Yeah.
It was constipation. When I had my gallbladder removed, it was IBS to the degree of like, if I looked at food, like 3 bites in, and I would have to go to the bathroom. And so it was
Yeah.
more in the spirit of too much information, that sex check listeners, like I would have diarrhea really fast. And then as I progressed and didn't change my eating habits, because I was 17 when I had it removed. And I came from a family that they had no idea that. Then
Yeah.
eventually it transitioned into constipation, and I couldn't eliminate. And then occasionally even getting impacted, and just like having a really hard time knowing something was going on with my, like my digestive system. And all regular doctors were just like, you have gastroenteritis, like take this pill. And like nothing was ever really getting to the root cause. So I made my entrance into functional medicine and doing naturopathic medicine a couple years ago, thinking that this is the year of prep for baby. And it happened to be the year that we were also getting married and all of that. And so did some work on the SIBO front, and then took a break, decided after several months of working on that, getting blood markers back, they were better. But then I wound up kind of finding myself back into some bad habits that I'm sure that a number of women who are listening to this might resonate with, where my bad habit is not eating. My bad habit is waiting too late. And at times when I've actually tracked my macros, I'm not getting enough protein. I'm not getting enough of the healthy fats. I live with a guy that pretty much lives by keto, which I know is not great for, especially for long-term, for women and hormones and health and all of that. And so I wasn't sure if I was going to go back down the functional medicine route, what I was going to do in this window of time where like, how much proactivity do I want to have with this whole baby thing? And then eventually, all that to say, I eventually kind of just surrendered to it all and was like, you know what, I'm going to get new testing done. Let me just get the tests and see how I feel about it and what's going on. And so I did a Dutch Plus for the first time, and was really interesting. Really, like, I wake up in the day and, wear it for first thing in the morning and have normal cortisol, and then it would tank all day, just like low, low, low. And so I had no idea that I had low cortisol and then essentially low everything else. Like, because this was low, apparently, and then you can probably describe this a little bit more. But it's like, it takes the reserve of where it would be producing for the other ones, because it thinks that I'm stressed out and we can't make a baby. We're running from a lion, or whatever the phrasing is, where it's like, if you're stressed out, then you don't have the reserve to be able, or like the functionality to be able to make some of those other hormones. And so I had no idea that it was like that internally. And so I have done a major refocusing of my life to de-stress my life. And then have also wound up discovering that there's H. pylori issues and have a parasite going on. And so I'm like, wow. And how much of this do I need to actually address before it's healthy and it's time for me to try for baby? So, the role of hormones in all of this, getting to the root cause, this kind of maybe more of the deeper work that you do. And how can people choose, roots of care and what to really listen to, and how much to like absorb and say, okay, now I feel empowered, I'm going to go make my decisions, versus that is a lot and I'm never going to be ready.
Yeah. Okay. Well, we have to get the gut ready, because your gut microbiome becomes baby's gut microbiome. And that's like everything in life. Right. And so, big thing that often gets missed when treating H. pylori is that you often are swapping it in your saliva with your partner. Right. So it's not an STI, but your partner needs to be treated too, because otherwise you're just going to start like keep reinfecting each other.
Yeah.
Once we have the H. pylori cleared, like the hydrochloric acid is really important. So H. pylori is suppressing hydrochloric acid. It's why you get heartburn. That seems confusing, but because you need a certain amount of hydrochloric acid for the esophageal sphincter, the gatekeeper between your stomach and your throat, to close. And we need that to liberate all the minerals and nutrients that are especially important for your health, but for baby's health as well. And when we are pregnant, we like, especially as we get into the third trimester and then into the breastfeeding phase, we need a lot of nutrients. We don't want to lose our teeth, right? We want to keep healthy bones. Like, we don't want to like have to borrow our calcium, like get your calcium, right? So you're going to need stomach acid for that. When you have ample stomach acid, you eat sushi and a parasite dies. When you don't have ample stomach acid, you eat some of these things. By the way, like a good sushi, like you shouldn't have to worry. But if you're an airport eating sushi, friend, you are like the biggest risk taker I know. Like, that's a lot. So with that though, like, we've got to get the stomach acid right. And we've got to clear out a parasite, because when there's inflammation in the gut, that is something that the adrenal glands perceive as stress, because their job is to produce cortisol that dampens that heat, basically, like helps with the inflammation. And we know that the gut and the vagina, they are sharing microbes, and that inflammation in the body can affect inflammation in the uterus. And what's interesting is that there has been preliminary research. We need a lot more to understand this, but it speculates that when a fertilized egg is making its journey, so everybody knows egg and sperm meet in the fallopian tube. This is why there can be a risk of ectopic pregnancy, and that is outside the uterus. And then it makes a little journey down, and then embeds itself in the uterine lining. There is research that speculates that it may actually survey the environment and be like, okay, how are our nutrients? How's our inflammation? If things aren't looking good, it doesn't actually implant. Like, something happens. Is it the fertilized egg that's making this decision, or is it your body making this decision? We don't really know. But is this your fault? No, it is a must happen kind of thing, because you've got healing to do. And so This is this is a keep you safe mechanism. So that's definitely important. Now, as you were talking about with the low cortisol, so I would just say, like, everyone definitely clean up your gut, and you can do that usually in a matter of like 3 months. And sometimes sooner. Like sometimes, depending on what's going on, you can move through things sooner. But like an H. pylori treatment is going to be at least 2 weeks to 30 days.
Mhm.
And then a parasite, God, I hate parasite. I hate yeah, I talk about STIs in my book, and then the ones I like really
Yeah.
freaking hate are like the parasitic ones. And I'm just like, oh, you're disgusting. I hate you. Like, I wish that you did not like plague the world with your presence. So parasites can definitely take longer. But as you were talking about with the low cortisol piece, so in the book, Is This Normal? I have quizzes that I have all kinds of quizzes and checklists, but I have a
I know, they're
main one
awesome.
that gets into the second half. It's in the second half of the book. When you get in, there's a quiz like right away, and it helps you evaluate your hormones. And when I talk about the low cortisol, it's really funny because there's a box about low cortisol. And my editor was like, we got to cut things because, yeah, it's 126,000 words. I submitted way more than that, but like we had to cut things. And that was one thing that my editor's like, let's take out all this stuff about low cortisol. It doesn't seem necessary. I'm like, no, people need to understand that low cortisol is really like rarely truly low cortisol. It is usually a response, because what I see a lot of people do is in their minds, they're like, okay, I just need to get more cortisol. And then they are like getting adrenal glandular supplements online and being like, oh, I need to like take mass amounts of that. And I'm like, oh my God, you're gonna have so much anxiety. Like, I don't want to be
Right.
in your body. Like, I feel for you right now. And that's not really the problem. The problem is it's been too much high cortisol for too long. High cortisol is a bad state to be in. It is pro-aging. Not like, I mean, yes, you will get like fine lines and wrinkles and not look as young. Yes, there's that. But at the cellular level, your cells are aging rapidly, and that's not compatible with life. And so your body being really wise is like, let's downregulate receptors. The HPA axis starts to get wonky. So that's how the brain and the adrenal glands talk. You start deactivating enzymes, activating enzymes, doing different things to compensate. And then you end up with this low cortisol state. And that's where, people are like, oh, we need to like, turn up the fire. We need to like pump on the gas. And I'm like, you actually need to slow down. Really. And what you did is exactly perfect, like reevaluating your life. There's this really interesting thing that I've experienced, and a lot of my patients have talked about, and I've heard a lot from women, of like how when you become pregnant, the way the hormones affect you is you start just not caring about some things. Like there are literal moments where someone says something hateful or attacks, like it's usually like if you attack someone else in my community, like we're gonna have beef. And I just want to like write like, shut up, get out of here, like stop trolling, like just be like really like blunt about it.
Yeah.
But it is this way of being where you just, it's like your body, your hormones just start shifting your priorities. And those priorities are, does it actually matter? Okay, we're going to invest in that. And then if the answer is no, it doesn't, you start letting things go that really we should have let go all along. But it took like those yummy, nourishing hormones to come in and be like, okay, let me tell you how this works now. So yes. So anyhow, with the adrenal piece, I think people get like really, like, stress is bad for our fertility. Stress is bad for, I mean, for everything, right? I have protocols in the book to help with adrenal health, but I think, there's definitely people out there that are like, oh, if your adrenals aren't right, like, you have to spend like, the next 18 months getting those right before you can get pregnant. And it's like, I don't know that you really do, but also know that like the hardest thing that's ever going to happen to your adrenal glands is being a new mom. Like that is real talk of like not sleeping, not eating regularly. Friend, you're going to have to set an alarm. When you finally have that baby, you're going to have to
Oh,
set an
yeah.
alarm to eat if that's your problem,
I'm
because
doing it now.
it's
I'm already
really
doing it.
common thing to like forget to eat and to be like, oh, I seriously drink collagen. I drink collagen like all the time. Especially being in my 40s, I'm getting really not neurotic. You have said that word earlier. I'm like, why do I want to say that word? Because it's not.
Yeah.
But really just seriously tracking my protein, because I don't
Yeah.
want to end up a sarcopenic obesity case, because that is, I mean, that's what I studied in when I was studying my master's in nutrition, and I just don't want to be that. And so, but that's something that, there was a recent interview with Gwyneth Paltrow that like people are just hating on. I don't know. Did you hear it?
I know, I just saw other people's commentary. I didn't go out of my way to listen to it.
So it was a clip, but like it was just a clip that popped up in my TikTok feed, and it actually was Dear Media that popped up, which is the original, because I had like interviewed with them, and TikTok's like really smart, that they knew I was at Dear Media, so they put Dear Media in front of me. Again, the algorithm.
Yeah.
And the clip, like she's talking about like how she fasts and she doesn't eat until lunch. She's postmenopausal. So people like right away are like, oh, that's so bad for women's hormones. What hormones? Like she's not cycling anymore. She's postmenopausal. But she made a comment about like how she eats like lunch, and then she says, and then she says something about like, and I have bone broth, and people took it as her saying she only ate bone broth. When I heard it, I thought she was saying like she ate lunch and then she had like bone broth with lunch. Like that's how I took it. I played it for my husband. I'm like, what are you hearing here? Are you hearing her saying that she doesn't eat and then she just has bone broth? And he's like, no, she's saying she has bone broth with lunch. And I was like, okay, right. Internet decided to like, because like, celebrities can be dehumanized. Like we don't have to treat them like people to like assume the worst and like attack her. And then my husband's like, hey, and like sometimes like you have bone broth with like collagen in it, and that's like all you have. And I'm like, yeah, okay, like nice call out. That sometimes happens because of my schedule and things that are happening, but I'm like, I'm still eating, sir. Like I'm not,
Right.
but I was laughing about it, that I was like, yeah, I can totally see like from your perspective, like, oh, you think that's what's going on. I'm like, you missed the trail mix I have stashed in my office and like all this stuff. But he was like, I don't understand. Like you do that. I'm like, okay, but like I'm also having like 20 grams of protein added into the bone broth. And like, it's a lot more than that. Anyhow, that whole thing I just found really interesting, just how like people were criticizing her. And it made me think about like, because people were just like, you have an eating disorder. And I'm like, okay, like armchair, like psychiatrist, like coming in to like judge somebody you don't know on the internet, like super weird. And but I was like, man, this must be a barrier. Like this creates like these same dietitians and like medical experts that are criticizing her don't realize how their bias is showing. And it makes such a barrier that someone like you can't say like, I've got a problem that like, I won't eat enough. And like, I skip meals and stuff. And how we can't just like have that conversation of like, we have this culture of like being so busy that we can forget to feed ourselves. And it happens. It is a real phenomenon that happens. And I don't know. So just us talking about it brought up that whole thing of like, how just seeing that on the internet and just seeing that like, wow, that really makes it to where people can't just have that conversation, that like sometimes that happens. And that is really not great for our adrenal glands, because they will absolutely have to mount a response to liberate sugar from your liver primarily, but even your muscles are going to be like, we have to give some stuff up. Like we have to start liberating these glycogen stores so that we've got enough energy and enough fuel. And then insulin is like, well, now I got to come out. And then, norepinephrine and epinephrine are like, we're going to be hangry now. Like we're not going to be happy about all of this.
Totally.
But it's a real thing that happens. Like, whether you are a mom or I hear it from attorneys, these same doctors who are criticizing her, I'm like, tell me what residency was like. Tell me about it. How was that for you?
Right.
Like,
right.
because you're out, I will also see them out there criticizing people for like not sleeping and all this stuff. And I'm like, yeah. So what profession are you in again? Yeah. Like still upholds like abusing people's bodies and not sleeping. So, I just think we need to just honor the fact that like, we don't get it perfect and we don't get it right as humans. And as providers, we need to be objective, less bias, and more supportive, that like life is just, it's crazy. So I'm like, look, my book comes out soon, and I'm literally telling people like people are like, I'm getting texts about play dates and stuff. And I'm like, I'm so sorry. Can you text my husband? Cause I literally can't manage this right now. Like my plate is full. Like, that's where I'm at right now.
Yeah. And it's so real. And then somewhere in there could be a lot of people that are not absorbing any of the information at all and are just rolling with the punches as they come. And I'm not necessarily, I mean, like, I wonder what that experience is like, where they are maybe a little bit detached from the social media thing and the online pop culture world and all of that. And maybe disconnected from, I don't know. I mean, I think about people that I grew up with from back home in down South Louisiana, and how, granted, they were starting to have families pretty young. So maybe that's a component to it, where it was just like, they're just like, oh, we're just going to get pregnant. And I don't know what level of cycle tracking or any of the things that I am doing now. I don't think that any of those, play a role in some interesting ways. It feels like an element of privilege. And also it feels like a jail at the same
Yeah.
time,
It is
like,
like, yeah, I would say like it is maddening making at times. But I will say that, like, I want to encourage you to keep going with tracking your
oh
cycle,
yeah.
because you will be able to dial in getting pregnant so much faster. Like, so many people, like, why is it that the recommendation is like, oh, if you're younger than 35 and it's been a year of being unsuccessful, go see a provider. And then if you're over 35 and it's been 6 months, then go see a provider. Why is that? Because nobody's like talking to you about when to do it. Like, nobody talks to you about like anything about the whole sex component of like life and being in a relationship. It's like why I wrote this whole book, like so we haven't even like talked about the book this much, but is this normal? Like, the first
Yeah.
section is all about sex. And like, we don't talk about sex. We don't talk about what does sex mean. We don't talk about like what's normal, what's not normal with sex. And then the majority of people don't even get taught when to have sex if you want to have a baby. And so definitely knowing when you're ovulating and like, it takes at least 3 months to
Yeah.
really dial in the temperature. I don't know what you're using. I use an Oura ring, and it's connected to natural cycles. And I love that. And because it just does it for me. Like, I just press a button and it syncs and it's done. And that's it. Like, and I don't have to worry
Right.
about it and do anything additional other than tracking like my physical symptoms of like, oh, that's fertile cervical mucus. Oh, I'm, and like my libido's up, which for everybody listening, if you're just like, Jan, I don't even want to have a baby. Like, why are they still talking about this? This is just where we landed today. This is just like where we landed. But it's important to recognize that like, there is a sexual phase of your cycle. It's the ovulatory phase. But what I like about, I came across a research paper that was like, there is this like 5 to 6 day sexual phase of the cycle. And I right away was like, they're talking about ovulation. Like, I know they're talking about ovulation because I know what your hormones are doing and all of that. But what I liked about that is that if you're trying to get pregnant, and I think just if you're trying to understand your body, understand there's an
Right.
ovulatory phase. But if you're not, and the furthest thing from your mind is a baby, being able to frame it in a way that doesn't just reduce you to your like reproductive capacity, or talk about it in a way that doesn't like, rip the bandage off the wound every time if you have experienced loss, is really empowering. And if people are like, well, just get to it, like, when is it? No, you have to read the book. No, I'm just kidding. I'll tell you. I don't like people who do that. So
Both. It's both. We'll tell
yeah.
you and
So,
read the book.
yes, I will tell you and read the book. Okay, so the sexual phase is the part of your cycle where estrogen is rising. So estrogen rises and then spikes. And that spike in estrogen mid-cycle-ish is what tells the brain that the egg is ready. The brain then releases LH hormone, luteinizing hormone, that causes the egg to be released in about 24 to 48 hours. The quicker the egg is released, the shorter your sexual phase. That's about 5 days. But if it takes 2 days, then you get that extra 6th day. Okay, so it is when estrogen and then both testosterone are rising. That's about 3 days before the LH spike. You're gonna be a lot more in the mood. You're gonna have sex more on the brain. You're gonna be easier to orgasm. You're gonna be into experimenting more things. You're gonna be feeling yourself. You're gonna be like, I look so good. Like, I feel so good in my body. Like, everything is just so good in that sexual phase. And so then LH is going to spike. Okay, now we're in the 4th day. And then the day after is the 5th. And then as soon as ovulation happens, what is left behind is a temporary endocrine structure in the ovaries called the corpus luteum. The corpus luteum's job is to make progesterone. This is the only time you have sufficient progesterone in your body is post-ovulation. And progesterone is like, nice try. to get that sperm. You had your chance, friend. We are not going to be pursuing sex in the same way anymore.
Right.
And so progesterone is like, it's the vibe is like, I want to get in some sweatpants, not in their pants, not in their pants at all. And so that is why and this is, I think, always so important in heterosexual couples for men to understand, because it's usually by like the second week, going in the second week of the luteal phase, men are like, why is she not into me? Sorry, I can see it, like my hair got in the plant leaf. So they're like, why is she not into
Right.
me? And it's like, well, because progesterone, because progesterone. So she was really, really into you. And now she doesn't seem as into you, but it's not that. She's just less inclined to initiate sex, to think about sex. But like, if you can, and I talk about the sexual excitation and inhibition model in the book, which is basically like what hits the gas pedal and the brake. If you can remove brakes in the luteal phase, then all of your gas pedal advances, the things that turn her on, are going to be better received. And it's going to be one of those situations that if you can start stimulating her and her nervous system gets the message and her brain computes, it's going to be like, oh yeah, no, wait, this thing, we like this thing. Let's go. But it might take a little bit longer. And by the way, so everybody knows, I do break this down in the book. There's a whole lot of chapters about sex. And then we get into the 28-day program where I take you through the cycle and sex, and you have all these exercises to do. You can just focus on just fixing your hormones. If you're like, I just got hormone problems, I don't even care about like anything else, that's fine. If and when you're ready, and I hope there's a when, you can come back, you can do the sexual stuff. But I just really wanted to make it so people understood what their normal is, because I'm sure you experience this a lot, but when it comes to talking about sex, and when it just comes to sex in general, it's always comparative. I mean, we don't sit here and go like, oh, why isn't my period exactly like my friend's period? Why is it my cycle's not exactly like my friend's cycle? Like, why is it my sleep's not exactly like, my neighbor's sleep? When it comes to libido, when it comes to sex, like, we're comparing. We're like, it's sometimes high key comparing, but a lot of times low key comparing, or like looking at media and being like, oh, why don't I have that kind of relationship? And it's like, well, because that's fictitious. It's not real.
Yeah. Yeah. It's so big. And I think I was saying that, I think, when we were first getting the podcast underway, where it's like, fertility and the pregnancy thing and all that is definitely a big in my own personal world, but the health and vitality of the cycle of your sex, of your hormones, of your drive, all of that, like it's indicative of so much. And there's so many there's so many pieces and parts to that. And what could be the cause of, let's say, a hormone being out of whack, or being low, or being high, or feeling like your libido's maybe down, or feeling like it's really up, or there's so much to there's so much more to the conversation, and there's so much more to like understanding health, not just from the perspective of I want to make a baby with all this information, for 33 years of my life. Well, from the point when I started having a period at like 14. So, from the times that I've been having, and then the times whenever I wound up being sexually active. So over the course of my sexually active life, all of my gaining information has been so that I don't have a child. So, and so there's some people that are actively, what do I need to know in order to not? So you can take all of the information that we've been discussing and just kind of reverse engineer that, or like layer your own lens over it for what you want, because we're talking about the window of when you can have a baby, but it's the same when you don't want to have a baby. That's the same window that you would avoid, and you in still looking, I've had so many people come to me and they're like, we're talking about their sex life and all this, that, and the other. And then they'll say, oh, well, my cycles are, and they'll insert something that's like not necessarily under the category of normal, where they're like, yeah, I don't know, I haven't had a period for like a while, and it's kind of irregular, and I'm like, whoa, what are you doing about that? Oh no, it comes when it comes, and it doesn't when it doesn't. I'm like, let's talk about your life, And so, I mean, my scope of what I'm open to helping them with only goes so far before I'm like, doctor, we need to have more of a conversation. And sometimes the role that I play is just getting them to a place where they open up to it, and that they start to get curious, and then I can help with their mindset around it. But I mean, if it isn't clear throughout the conversation that we just had, like, I'm still figuring out the mindset around it. Like, where
Mhm.
do I, to bring back the word neurotic, like, where is my level of like, I feel empowered and all this information is great. And then like, here's the line where like, I'm now spiraling out of control, and we're figuring it out. I think every cycle and season that passes in a person's life, we're just figuring it out and doing the best that we can with the information that we have, and kind of, really looping this back to the book, which we've touched on just periodically here and there in the convo. But I looping it back to here is like, you do the best with the information that you have. And this book has a lot of information. And it's not, what I love about this is that it's not just, long form, here's information. It's broken down with, is this normal? And here's the topic. And then here's the next topic. And it goes in this really layered, step by step, like how it progresses. And then I love the, what you were talking about, the 28-day program at the end, where it gives people actionables. It's not just a book that they have and they read and then they're like, okay, cool, here's the answer to some questions. Now what do I do? There's
Mhm.
information in the book that leads you to being able to taking action. I think that's the next layer of empowerment, is like, once you have the knowledge, how do you become confident in that knowledge? You become embodied in that knowledge. You actually integrate that into your life. And so between the quizzes and the program at the end, I haven't seen a book, a book hasn't come into, and I'm like looking at my office, and whether it's the books that are behind me, which is the little bookshelf, but then there's also a bookshelf in the closet and two bookshelves in the living room. That's a slew of personal development, fertility, and sex education oriented books. But I haven't had anyone be this comprehensive. And so I'm a big fan, and I'm excited for when it is going to be released and what people are going to gain from it. And so I know we didn't specifically go into kind of how it's broken down. Granted, I gave a little bit of a high level overview there, but I would love if we could just like round out maybe in the next couple minutes, what you would like to share,
Mhm.
your mission with this book. Because we know, Beyond the Pill was the first one that was just, revolutionizing for so many people, especially from my age, where it was like, I was just handed the pill in high school, and it was just kind of like, oh,
Yep.
here you go, you get to have this. And so, people, if they want to go down that rabbit hole, then they can get your first book. But would love, what's the mission, what's the message, and what do you hope that this book does for people?
Yeah. Well, one thing I want to say that you've talked about so I get into this in the book, and that's why I want to talk about this for a minute. Is just you're like,
Sure.
there's the perfectionism, and then there is the like empowerment. And where does that lie? And I talk about in the book, I give an example of like two scales, like the old school scales, like you put weight on and it tips one way or another. And I talk about how, if we're saying like, oh, you want to be making optimal decisions and all of that, but you start aiming towards perfection, if one side is like, the good, and then like the optimal, and then the other side's the suboptimal, I mean, like, hey, life is handing you the suboptimal, so there's going to be some there. But if you start going into perfectionism, then you take what you would be putting in that optimal and you start flipping it over to the suboptimal, and you're creating that imbalance. And so there needs to be a middle ground. I mean, there's a part in the book where I'm like, yeah, I'm literally a heretic in the wellness industry for saying that, like, you can have your cake and balanced hormones too. Like, you should be able to. Life should not be so strict. And so with the book, I wanted to be able, like, look, I think we've all had this experience of like going to seedy sites on the internet, or having to ask a friend, or having an uncomfortable and maybe even really judgmental conversation with your doctor, trying to seek out information about what's normal. And I remember, like, I mean, back in the day, there was no internet. I was like Dewey Decimal Systeming my way to like what is going on. And the books were crap. Like, they were not good. Like, and so I just really wanted to write the book that said everything that sex ed should have said, that taught us everything about our hormones, our body, our pleasure. And I took notes from the countries that are doing it the best. And how are they doing it the best? They have the most sexually satisfied people. They have the less, incidents of STIs, of unwanted pregnancies. And we also find that their kids actually delay their first sexual activity. They're having it later, and then they report that it was consensual and enjoyable, which is very different. The United States, people are having it younger, and they're like, I felt pressured, I felt coerced, I regret it, it was not pleasurable. Like, this is a real problem. And so I wanted to teach health from that perspective of pleasure being important, because pleasure is essential in health. Like there is no mistake made in making the clitoris like this amazing, wonderful organ. And if people are like, oh, tell me more about that. I got 3 diagrams on the clitoris that I commissioned someone to hand draw to help you understand the clitoris. But, so people understand we've been talking about pregnancy this whole time, right? Okay. So like we all start off phenotypically female. And then if you have an XY chromosome, by the way, it's just like really simplistic because nature is much more messy than this. Then a testosterone wash comes in. And that Y chromosome, should it respond, because sometimes they don't, but should it respond, there will be differentiation. And no longer will you go labia, clitoris, vagina, you go scrotum, penis, like you go a different route altogether. But that penis was the clitoris, except the penis has to pee and ejaculate and is on the outside. So like it can't be that sensitive. So the clitoris gets to be all kinds of sensitive and just do one thing, bring you pleasure. Like, why are we not talking about that more? So my aim is that I want people to have more understanding about their body. I want them to have more pleasure, and I want them to have more productive conversations when they do need a provider. So in the book, there's checklists, there's all kinds of things for you to understand what might be going on. I did a whole protocol. And then I also was like, that's not enough. Let's do this cycle symptom relief chart. So if you are having symptoms, like you can go and you can troubleshoot those things. And these checklists, though, if you do need to see a provider, like you were saying, like, oh, you have irregular periods. By the way, anovulatory cycles, that is not ovulating, therefore not menstruating, those are associated with less sexual satisfaction. So definitely take it seriously. For a lot of reasons. But if you're seeing someone like you, that's like, they're like, I need sexual health. It's like, friend, you need physiological health as well. There's more than one thing to be done here, which is why it always takes a team. And that is definitely a motto that I have. So with that, though, these checklists, they provide you data about yourself that you can go to your provider. And when your provider's like, I don't think you have that going on, you're like, well, here's a list. Okay, actually, and I do, because I think I have all of these things. And what have you done to rule this in and rule this out? And like start to have a better productive conversation so that you can get that provider to help you. So the mission of the book is for you to know your normal and know your body better than anyone else, because you already do, but society and doctors and mothers and fathers and friends and siblings and like everybody is like interjecting what they think is normal and like influencing you in ways that make you doubt what your normal is.
Ooh, it's going to change lives. I can only
Let's
imagine,
hope.
Yeah, I mean, I would imagine that's a part of the goal, but I can see it now. Someone getting the book and going through some checklists and then going, I wonder. And then going into, their medical professional and being like, look at this. And then it leads to something that's revolutionary for their health. And that's so incredible. So thank you so much for taking your time coming on and sharing your news, which I don't know when the episode is probably going to go out around the time whenever your book is launching. And so I don't know if you will have been public with your news, but congratulations.
Like,
yeah, I know.
The stress of saying the words.
I know. Well, I'll be patiently waiting, and for whatever the news is. And, and also like holding that hope and vision and in prayers and all the variations of that. And I'm thinking, for myself too. So it's like in the next couple of months, maybe into the next year, I might have to send you a little message, or it's like, oh, hey, this happened for us too.
Yeah.
So
I'm gonna be sending you all the baby dust.
Yeah, it's like, it's such a vulnerable and beautiful and fucked up thing. And it's a miracle, and it's a miracle every time. And so, so I'm so grateful that you took the time. I'm so grateful that you put this book together and put it out into the world, and that you're doing the work that you're doing. And so where would you like for people to find you? I know you've got a really fun TikTok going on, a thriving Instagram community as well. And then soon I think they'll be able to get this book anywhere where books are available, and they can get it pre-ordered ahead of time too.
Yes, they absolutely can. And you can find me at drbrighten.com, drbrighten.com. And I'm on TikTok, YouTube, and Instagram at Dr. Jolene Brighten. And before we go, I just have to ask, is that a selenite penis behind you?
Oh,
On your
right here
shelf,
on my
the third
shelf,
shelf down.
it's a rose quartz penis.
Oh, okay. It's a rose quartz penis. Cause I was like, selenite
Close.
would not be safe.
Oh no, she's
What if
she
it's splintered?
he's a rose quartz. That's my I have like several shelves there, and that's the one that's got all of the different crystals and metals and all of that are behind me. Yep, yeah.
We
We
had to
work
cut the sex magic from the book and talking about like using crystals and
oh,
all of that. I really wanted to keep it, but yeah, they opted for we should discuss vaginal steaming. And I'm like, I just feel like it's so boring and played out. Let's talk about how some people like to
yeah.
use crystals and they like to actually like meditate and channel and like they do
Oh yeah.
like channeling energy and like just yeah, and they
Yeah.
manifest and they do all of these things. I think that's fascinating.
I think
And
it's
it's also
fascinating too.
something that, you know, medical providers are quick to shame people about
Mhm.
and be like, you should not be using that. Da, 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 da. And so you always have to ask more questions because
Yeah.
they unfortunately don't make us feel as culturally competent as we should be. But again, there's that dropping that bias. But I was just like, this whole time I've just been staring at it and I'm like, I'm pretty sure that's what it is. Oh no, I'm talking about the next shelf up. I didn't even see that one. What is that
Well,
white thing? I'm
oh,
like,
she's an OG.
oh, it's a
She's
magic
an
wand.
OG magic wand.
Oh my God. Wait a minute. You said when you came on that we met at the Bulletproof conference briefly.
Yeah.
Did you read the masturbation chapter in the book?
In this, no, I don't think so. No, I've
Oh my God,
skimmed
there's
the
a
whole
whole
thing.
story about me being at that conference.
Oh,
Oh my
really?
God.
Okay,
Yes.
so I don't
And
think
how
so.
Sex with Emily loaded me up with a bunch of sex toys.
Oh,
And
amazing.
actually, I just was on the Model Health show and Sean was one of the people I saw as I like had like a baby arms full of like sex toys trying to like make it through the lobby so nobody would see me with all of these things. And he's like, I remember this like seeing you and being like, what's she doing? It looks shady. Like, what's she up to over there? It's so funny that that's the conference we met at. And then I'm like, oh, because that was the first time I was gifted with a magic wand. I still find that thing really intimidating and intense. And I'm
Yeah,
like,
yeah,
I'm just not Samantha
yeah.
level. I'm not
Yeah, I
Samantha
know. It's
level.
maybe more like an actual back massager for you than
Yes,
the
definitely. But also,
Yeah,
everybody who stuck around on the podcast, because people dip out when it's like, where to find you? Everybody else just got to
sure.
hear like,
Sure. Yeah,
like
yeah. The
the real,
bonus.
real.
The bonus. No, I
Yeah.
know. And even your ass, so there was like a crystal penis on the one shelf. And yeah, and it's funny because I'm often I find myself to be that someone in the middle. I have a shelf of all the sacred sexuality tools, and I'm the one that's like, hey, we need to talk about the real risks and what are you actually looking for, and
Yeah.
porosity and splintering and
Yes.
and
Yes.
bacterial the vaginosis causing things
Yeah.
and just all of it. And yeah, so I was with you there. Whenever you asked, I was like, no, that thing's not selenite, that's a rose quartz. Anyway, but I
Yeah.
have
Yeah.
that and I have a magic wand, and we have
I would
lots
hate
of
to be the one to be like, friend, you cannot use selenite. Like,
busting
yeah.
everyone's bursting their hopes and dreams. No, yeah, we got it down. Dr. Jolene, you're awesome. I love your energy and your spunk and your realness. And I'm leaving this conversation with so much hope and empowerment and then elements of almost like there's always something to learn. There's always something to find, especially when it comes to like going on a health journey and just being really at peace, trusting the journey and like going for the data and the information again, from that perspective of like, I'm going to do something really good with this. And I'm going to be patient and I'm going to be kind. I'm going to be compassionate to myself, and my
Definitely.
partner.
That drops
And
inflammation, friend. Being kind to
yep,
yourself drops inflammation.
Yep, working on that for sure. But yes, thank you so much. I can't wait to share your book with everyone. Yeah, and congratulations.
Thank you.
Mm.
Okay,
Ooh.
that was fun. And seriously,